Welcome to Miss Ideal Girl, the headquarters for love, sex, and everything in between. If you have ever felt confused about love, curious about intimacy, stuck in a relationship, healing from heartbreak, or just trying to understand yourself a little better, this is your place. On this podcast, we talk about the real stuff. The feelings, the questions, the fears, the chemistry, the boundaries, and the truths that shape our relationships and our lives. Every episode is here to help you think deeper, feel seen, and navigate love and intimacy with more clarity, confidence, and honesty. Let's get into today's topic. An individual's sexual health may be significantly and permanently impacted by sexual trauma, including sexual abuse and assault. A person's overall sexual functioning, interpersonal relationships, and sense of self can all be impacted by this kind of trauma in addition to their physical and emotional health. Sexual arousal or desire problems are one of the most prevalent effects of sexual trauma on sexual health. Trauma can result in emotions like fear, anxiety, and shame, which can make it difficult for a person to feel pleasure or desire during sexual activity. This might make people less interested in having sex or steer them away from it entirely. Sexual dysfunction can also be a result of sexual trauma. When engaged in sexual activity, physical symptoms like pain, numbness, or burning may occur. Because of these symptoms, engaging in sexual activity may become uncomfortable or even intolerable, which will cause people to avoid it even more. An additional typical effect of sexual trauma is difficulty in sexual relationships. Trauma can lead to feelings of distrust, fear, and anxiety that can make it challenging for a person to establish and maintain healthy sexual relationships. This may make it difficult for couples to communicate, be intimate, and build trust. A person's sense of self, including their sexual identity and orientation, can be impacted by sexual trauma. One's sexual identity may become unclear as a result of the trauma, making it challenging to comprehend and accept one's own desires and feelings. Sexual fantasies and desires can also be impacted by trauma. The trauma may cause negative associations to form as well as unwanted sexual thoughts or fantasies. An individual's capacity to enjoy sexual activity may be impacted by these feelings of guilt, shame, and disgust. Sexual trauma may have an impact on intimacy as well. Building and maintaining healthy relationships can be challenging after trauma because it can make it difficult to be physically and emotionally close to someone. Not just romantic relationships, but also friendships and family ties may be impacted by this. Sexual trauma can have an impact on one's sexual boundaries. Setting and upholding healthy boundaries in sexual relationships can be challenging after trauma. Consent issues and a lack of control over one's own body and sexual experiences can result from this. It's crucial to remember that sexual trauma is not a chronic condition, even though it can have a significant impact on a person's sexual health. There are many types of therapy and treatment available to aid in the processing of traumatic experiences, healing from them, and the development of coping mechanisms for dealing with the ongoing effects of trauma on one's sexual health. One type of therapy that can be useful for people who have experienced sexual trauma is cognitive behavioral therapy, CBT. The main goal of this kind of therapy is to recognize and alter the destructive attitudes and behavioral patterns that can develop as a result of trauma. Another type of therapy that has proven successful in treating patients with sexual trauma is EMDR therapy, eye movement desensitization and reprocessing. In order to process and integrate the traumatic memories, this type of therapy involves recalling the traumatic event while performing particular eye movements or other forms of bilateral stimulation. Sexual trauma can also be effectively treated with other trauma-focused therapies like somatic experiencing and sensoromotor psychotherapy. These treatments concentrate on the bodily signs and symptoms of trauma, such as feelings and sensations, and they can aid people in processing and integrating their traumatic experiences. It's crucial for people who have endured sexual trauma to get support from friends, family, and other close relatives. Support groups, like those provided by rape crisis centers and other institutions, can also be a very helpful source of understanding and support. Sexual trauma can significantly and persistently affect a person's sexual health. However, those who are experiencing sexual trauma may be able to recover with the right care and support. And that wraps up today's episode here at Miss Ideal Girl, the headquarters for love, sex, and everything in between. I hope this conversation gave you something real to think about, something to feel, or maybe even something you needed to hear at exactly the right time. Love, intimacy, relationships, and self-discovery are never as simple as people make them sound. That's why we're here to talk about it honestly, openly, and without the fake polish. If you enjoyed this episode, make sure to subscribe so you don't miss the next conversation. There's always more to unpack, more to learn, and more truth to talk about. And if this episode stayed with you, share it with someone who needs it too. Until next time, stay curious, stay honest with yourself, and keep exploring everything in between because your heart deserves better conversations.